Dr. Perkins is wonderful. He's very down to earth. He's very personable and reassuring you and trustworthy for the skills and the procedures that he did. I felt very safe in his hands.
Good morning. Good to see you. I would like to have you, if you can explain to me some of the concerns that you have about the facial contours that we're looking to improve with the addition of fillers this morning.
Well, I would like to see some work done in the area across the middle of my face. Mainly like under the eye area, it's darker and it's gotten more sullen and looking, and also around the lip area and through here.
I think in addition to that, the things that strike me is that when we look at the lips themselves, we can add a little bit more volume and fullness to the lips without them being overdone, just to give more youthfulness. We can also, you can see where you have a little bit of early jowling, we can help to straighten out the jawline by putting a little bit of a filler at the commissure, the corner of the mouth, as well as along the jawline. And in addition, I think when I look at the brow, this area here is one of the things that will lose volume with aging. And so by adding a little bit of volume to the lateral part of the brow, we can not only give that volume back and give a more youthful look to the brow, but we also tend to get a little bit of a subtle elevation of the brow at the same time. And that lifts the upper lid a little bit and gives a more youthful look there as well. What we're going to be doing now, we'll go ahead and mark the areas that we want to put the filler in with you in an upright position, because the effect of gravity on the tissues will change when you lie down and we do the actual filler injection. Then as we go forward, we'll have you sit back up when we feel we're close to the end point, and we'll look at the contours, and we want symmetry, but we'll be using radius in a deeper level, which is more of a structural type of a filler and gives more volume underneath, and we'll use the hyaluronic acid fillers like Restylane or Perlane more superficially, where we can have the softer effect of those fillers in the lip area or in wrinkles that are more superficial, in the eye area, and even in the brow as well. By combining those two types of fillers in a layered liquid lift, we can give a very natural appearance that actually will last you for probably a year plus. One of the things I wanted to point out, Linda, is that many people are concerned that there's going to be discomfort in putting the fillers in, and we want you to be comfortable while we do the procedure. So what we'll initially do is I'll put a little dot of some numbing in several different spots in the skin that we're going to access, through for the fillers, and we'll go ahead and put those little dots in first, and then we'll mix a little bit of the numbing with the filler so that you actually won't have discomfort while we're actually doing the filling. So then what we're going to do here is we'll just put a little dot, like I was saying, in the skin. One of the things that helps is when you put in your numbing to not try to go too quickly. You can make a quick entry into the skin, but then you actually inject your numbing very slowly, and it's a lot more comfortable that way. You can see what we've done is added a little bit of volume in the mid-face as well as in the periorbital area, kind of along the zygomatic arch and along the jawline down here. We put a small amount in the nasolabial fold and the lateral commissure, and we have also added a little bit of volume just to the upper and lower lips here as well. And what it does is it gives more of a youthful roundness to the face without being overdone. She has a little bit of blanching, as we call it, where it's a little bit sort of pale in color, and that's just the vasoconstrictor that is in the local anesthetic, so that'll wear off in, say, an hour and go away, and the skin will be back to the normal color. And the nice thing is that it just gives her a youthfulness that she didn't have a little bit ago. Well, basically, as we do the filler, like we were saying, what we want is to have things look very normal and natural, and I think that it's important to continually assess symmetry as well, because when you do whatever on one side, you need to make sure that it is replicated on the other side, or if a person starts out asymmetric, we can oftentimes improve symmetry by doing fillers, and we want to address that. So as we're doing what we're doing with the fillers, we need to periodically assess where we are. We're getting almost done here, Linda. How has it been for you, and what are your thoughts?
I'm feeling better than I thought I would at this point. There were a few little pokes in the beginning, but it's been a wonderful experience for me. I appreciate what you're doing, and I'm looking forward to seeing how I look when you get done.
Great. Okay. Linda, we're done with the filling now. I'd like to let you take a look and see what your thoughts are. You have a little bit of swelling, and that will settle down in a day or two, and we'll just let you see what you think.
Dr. Perkins, this is beautiful. I was speechless. I almost started crying because my cheeks and my profile through my cheekbones to my mouth area had been so significantly shifted to what I remember that I did look like 10 years ago. I almost started crying when I first held the mirror up to my face because I could not believe how quickly and how easily, for a non-surgical procedure, that I could look this good, this quickly, and how wonderful it was. I would recommend the layering to anybody, and I look forward to doing it again someday.